of this field, Dr. M.K.C. Nair sir, to enlighten us with his knowledge and experience. I now invite Dr. S.P. Sethi, Consultant Pediatrician, Director, Sethi Hospital, and Secretary, Jaipur AHA, to take us further in today's scientific program. Over to you, Sethi boss.
Thanks, Kusum, for a nice introduction. A very good evening to everybody. I welcome all the dignitaries, panelists, and viewers on behalf of Jaipur Adolescent Health Academy and Jaipur IAP. We are pleased to welcome you all to yet another academic event today on adolescent counseling by none other than Dr. M.K.C. Nair, sir. Welcome, sir. He is a renowned pediatrician, counselor, and academician in the field of child development. Then I welcome our eminent chairpersons, Dr. A.S. Chamla, sir, Dr. Sitaraman, sir. Then I welcome our president, Dr. Ashok Gupta, sir, and our treasurer, Dr. Mohit Vora, for unconditional support of all the AHA activities. Today, we have joined hands with IAP Jaipur branch, and we have done in a previous webinar also we have joined, and we have done so many activities along with IAP Jaipur branch. So I welcome Dr. R.K. Gupta, sir, the EB member from Rajasthan, representing Central IAP, Dr. Tarun Patni, President IAP, Dr. Manish Sharma boss, Secretary Jaipur IAP, Dr. Sanjeev Gupta, Treasurer Jaipur IAP, and Dr. Manish and Sanjeev, they are doing similar webinars from last few months, and all are with the national speakers. Then I welcome our moderators, Dr. Kusum Kalla and Dr. Priyanshu Mathur for today's session. Last but not the least, I am thankful to WEFA Elas for providing today's digital platform. To carry forward, I invite Dr. Swati Gate Madam, who is North Zone EB and representative of and one of our founder member and backbone of Jaipur AHA. She is head of the CDC, Newton CDC, Babylon Hospital. I now request Dr. Swati Gate Madam to carry forward the program and give brief introduction to this topic.
Thank you so much, Dr. Sethi. First of all, let me express my deep respect and gratitude to Dr. M.K.C. Nair sir. It is a great privilege to share this platform with him. He is our visionary guru. Me and many of us have been fortunate enough to get trained from him in adolescent and developmental pediatrics. Coming to the topic, adolescent counseling. Adolescent counseling is a very structured thing and a very different thing from what we guess, and from the guidance or what talking to adolescent is something really very different from counseling an adolescent. For that, we need a lot of time, passion, and many skills. And those skills are also required to connect with our adolescents when we take history in the HEDSS, and also when we want to deliver our health messages to adolescents, may it be the lifestyle issues or may it be their adherence to taking medicines. So sir will enlighten us today on the adolescent counseling and how better in our day-to-day practice we can connect and communicate with our adolescents. Thank you so much. I now hand over the mic to our President of IIP Jaipur, President JMA Jaipur, and President Rajasthan IIP, Dr. Patni sir. He is Director of Healthcare Hospital and Lifeline Hospital, and he is a very well-known figure and a leader of IIP in Rajasthan and beyond Rajasthan. Over to you, sir.
Yeah, thank you, Dr. Swati, for the introduction. And you know, today for IIP, it is a great moment that we have one of the most well-known pediatrician, one of the true pediatricians, right from neonatology to adolescent, who is working, who has given a lot of new things to Indian Academy of Pediatrics and Pediatrics for the whole world, Dr. M.K.C. Nair. We are fortunate enough to hear him again. And I remember that his talk, his oration during Paedicon 2011, and similarly, I remember completely his oration during Raj Paedicon held at Jaipur. We always have sought his blessings, and he has always been encouraging to give talks to all of us, and his visionary approach, his ideas, and his practical, easy to follow approach is really great. So I welcome him on behalf of IAP Jaipur and Rajasthan. Thank you, sir. Thanks a lot for accepting the invitation. Thank you. Now, Dr. R.K. Gupta, the executive from Rajasthan. He is a well-known figure. He is into allergy and pediatric gastroenterology. He is professor of medicine at J.K. Lawn Hospital, Jaipur. And with this, I will hand over the mic to Dr. R.K. Gupta. Thank you.
Sir,
Dr.
I
R.K.
think
Gupta
Dr.
is
R.
not
K.
there.
Gupta sir is not here. So you can invite Dr. Ashok Gupta sir directly.
So I will just invite Dr. Ashok Gupta, sir,
And say
professor
some.
pediatrics. And Dr. Ashok Gupta is one of those well-known pediatricians from Jaipur, Rajasthan, and he's at present President Neonatology Forum of World, and he's doing a lot of work in rare disorders in pediatric medicine. He's the pillar of that in Rajasthan and India. So please, Dr. Ashok Gupta, sir. Namaskar.
Thank you, Tarun, for inviting and in introducing me. And thank you for your kind words, Annette. This is a very, very special day again to have Dr. M.K.C. Nair, one of the most exceptional pediatricians that we have seen from the Indian Academy of Pediatrics. And especially because the issue of adolescent health has been brought to this country and as a part of the agenda across India has been initiated by Professor Nair, and he's been one of the most brilliant person that I have ever known. So it's a great day for the AHA Jaipur and also for the Indian Academy of Pediatrics Jaipur, because although we've been hearing him, to continue to hear him today, it's going to be a great day for all of us. And I have the proud privilege to introduce our chairpersons of the day. We have a very, very exceptional person, one, Dr. Ajit Singh Chawla. Dr. Chawla is a pediatrician and adolescent expert, and he is currently the director of Chawla Hospital in Ludhiana. And he is an unbelievable person in terms of his energy and abilities. And he's been trainer for Mission Uday, trainer for Mission Kishore Uday, trainer for Awesome Aya, and then he's been a trainer for the Hope program, and he's also a trainer for emotional intelligence. Unbelievable kind of a background and unbelievable strength. And he's been the chairperson of the AHA for the year 2020. He's been the vice chairperson from 2016 to 2019 for the AHA, the Adolescent Health Academy of the country. And he's been the president of the Indian Academy of Pediatrics Punjab. He's been the president of National Neonatology Forum Punjab, and he's been the president of AHA Punjab. Unbelievable person with those kind of credentials. I believe AHA has done so well, and he's been a key figure in supporting and making us do good thing in AHA at Jaipur. So welcome you, sir. Then we have Professor Sita Raman, the other chairperson. He's a professor of pediatrics at SMS Medical College, Jaipur, and he's currently in charge of this Child Development Center, and he's also the chief of the Neurodevelopmental Division at J.K. Lawn Hospital, which is part of the SMS Medical College. He's been the coordinator for, he's been named the coordinator for the Zonal Reference Center for CLMC. He has been on various committees and organizations across the country, and he's been on various positions in the pediatric academies across. So, and he's been fellow, WHO fellow in the field of mother and child health. And then he was also a Commonwealth fellow to UK, and he did his pediatric neurology as part of the Commonwealth Fellowship. He's a great academician and a great leader, and he's been the scientific chair for the National Neonatology Forum meetings. He's been the scientific chair also for the Indian Academy of Pediatrics national meetings. So he's again one of those very, very brilliant and exceptional persons, and he has led quite a few pediatricians in the country to really chase their dream in the field of developmental pediatrics and developmental neurology. And we also have a moderator in Dr. Priyanshu Mathur, who is another brilliant man. He is currently Associate Professor of Pediatrics at SMS Medical College, and he is a consultant in the field of rare diseases, and he was trained in Atlanta in the Emory University, where he did 1 year training in the field of metabolic and genetic disorders. And again, this afternoon, he was instrumental having one of these spinal muscular atrophy patients get a Resiplam, a very, very expensive drug, out of charitable access. Another brilliant man. So I welcome you all, and I hand over the mic to Dr. Sita Raman to take the proceedings further. Professor Sita Raman, please.
Thank you, Professor Ashok Gupta. It's a thank you for the nice introduction and good evening to all of you. I would not be standing much in between our esteemed speaker and you all, because we would like to listen to him more. And definitely, I welcome Dr. Chawla, and I will definitely want his opinion and when he sum up the end of the day, how the things are moving in the academy. I have found that the AHA, the local branch, has done exceedingly well. I'm so happy about it. And I welcome Professor Nair, who definitely does not need any introduction to any of our pediatricians or neonatologists or development pediatricians. He has stressed himself from the newborn to the adolescent. I don't know whether he'll step into the adult someday. But anyway, the whole day, a whole gamut of pediatricians he has taken over. And I think it's a pleasure to listen to him. I'll request Professor Nair to proceed with the talk. Professor Nair.
Yeah. Dr. Chawla, President of the Association, Dr. Ashok Gupta, Sitharaman, Kella, all dignitaries and all members of Jaipur chapter. I have had many good occasions to come to Jaipur. I enjoyed it. Let me start the day by saying, after building up the Child Development Center, where many of you had the opportunity to do the PG program, 5 years I disappeared as the Vice Chancellor of the Kerala University of Health Sciences. I never had a contact with anybody for 5 years, then came back. Incidentally, today is a very important day for me because what you see is a new Child Development Research Center I've built up in the private sector along with associated with the university. And we are completing 1 year of the program. And one of the two highlights I must say about the center. One, this is the only center probably where the patient has no compulsion to pay. If you want, you can pay. Don't feel like don't pay. Every month, a very expensive surgery for disability will be taken care of. I have the authorization to sanction any amount of 2 lakhs, 3 lakhs, whatever it is. One case per month. And we have started the adolescent clinic in the afternoon between 3 and 6. So systematically, we are trying to get schools children to come to the adolescent clinic. Again, if you want to pay, you can pay, otherwise no. Now, let me start from younger days. Whatever happened to me because of Christian Medical College, Ludhiana. Okay, I was there from 70 to 69, 70 to 80, 10 years doing MBBS, DCH, MD. That time, I used to send cases from the OP to the psychiatric wing, which was same half of the wing where I was staying. So naturally, I had interaction with the psychologists, psychiatrists, and I specifically remember Dr. Kala, who was actually helping me learn all this. So that's the primary training I had. When 1980 January, when I came to SAT Hospital, I started the Child Guidance Clinic. Just to get a flavor of what is a Child Guidance Clinic, I'm giving a data of one particular year, 2045 cases. Majority, 70% of your problem will be scholastic backwardness. This talk is only for general pediatricians, so where no high fluent stuff I am going to talk. Scholastic backwardness and whatever be the cause. Second most important you must know is somatization or conversion. In fact, I have published 500 cases of hysterical conversion reaction in 83, 84 in the Kerala Psychiatric Journal. Probably that's the largest number in the world literature of hysterical conversion reaction. I'll talk about it later. And then, of course, you have behavior problems. All of us face the problem. We don't know what to do with it because the parents will eat our head up, but the child is even worse. Now, let's take three things one by one. If you have a scholastic problem, you need to systematically evaluate. How do you evaluate this? I have help from Paul Russell, CMC Vellore, whom I consider is a very close friend of mine and a guru in child psychiatry. And first, of course, you look at the intelligence. Okay, we may say there's no meaning for intelligence, but if you have a clinical psychologist, get an intelligence test done because it helps the parents to understand what is the problem. Although majority of the time, 90% of the time, intelligence is not a problem. The problem is much more likely to be a subject problem. Particularly child may have. I'm not talking about learning disability. Learning disability is a average intelligent person, good in everything, but has difficulty either in writing, reading, or mathematics. Here, it may not be learning disability, but child may have a particular problem. Or there may be poor fit with the teacher. Now, if you have a problem with the teacher, you hate the subject, you become very bad. And you change the class, next class, the teacher changes, sometimes child pick up. Then whole lot of environmental at home as well as school. 3 people are important. Your parents, and second one is the school teacher and the peers. So when I do counseling, actually the child will come in front of you thinking that very scared that everybody is focusing on the child. Parents would have told me all bad things about him and he's literally scared, he or she. And then I quietly ask in the ear, which out of these two is the most intolerable? Look at father and mother. Invariably, they will say the mother because the poor mother is the one who take all the brunt. Their children adore the mother, but they also hate the mother for trying to discipline them. Father, nicely, as usual, he will sit quiet as if I have nothing to do with this. So that is the whole problem. That is one thing. Secondly, last, of course, you may think of mental illness because almost all mental illness start around 15 years. So when you have a high school, higher secondary school, this is so 5 things. If you have 5 points like this, intelligence, subject problem, poor fit, environmental problem, and mental health problem. Now, what is a conversion reaction? The symptoms or deficit affecting voluntary motor or sensory function mimic disease. Forget about all this. I will just say the child has intolerable psychological stress, and that will present as a physical illness. And the physical illness will present dramatically, and if you treat, it will go away dramatically. Remember the word dramatically. There's an intolerable psychological stress that is converted to a physical symptom. Just give an example. I had a child who said, who can't move the limb, upper limb. Neurologist also had seen no problem, everything is okay. So I just asked where the father is in Gulf. He was very attached to the father. So I just dialed it those days, around, dialed it and just gave him quickly, he grabbed it. So I know he has no neurological problem, but never say it is malingering. Don't blame the child. He has a illness, but only thing is that illness do not have a physical base, only has a psychological base. You still have to treat the child seriously with not physical method, but psychological method. So that is a hysterical conversion reaction. Patients actually experience the thing is not imagination, but only thing is it has no biological cause. Now let's look at behavior problems. All of us have behavior problems. We all show behavior problems at some times or other, even adults show. Now what is it? One other thing is ABC analysis. Just very simple in the OP, you can do that. If the child has a behavior problem, surely there is an antecedent and there is a consequence. Okay? So what is the antecedent? Your job is to try to find out what led to this behavior problem. Most often it is at conscious level. Sometimes it may be at a subconscious level. Rarely Freud ideas, the childhood experience, it may be at the unconscious level. A pediatrician cannot go into unconscious, but you can go to conscious and some amount of subconscious level. You will be able to find out. You will get cues as to what are the problems, antecedents. Then secondly, consequence. Your therapy is based on finding out what are the consequences. But do not advise the child about consequence or do not try to frighten the child. They don't get frightened. They have seen all this through. You make the child become friendly with the child and say, beta, we will have a chat. Forget about parents. I don't want. And if you don't attack the child to begin with and don't seems to listen to the parent so much, I don't want to listen to the parent. I want to listen to you. And most intelligent parents understand this is only a trick to get the child on your side. They will tell out, and you make him write 1, 2, 3, 4. What are the consequences of this behavior? And once the child understands the consequence, he will try to avoid it. But if you try to advise him, he won't do it. Get the point? So what that you have a behavior modification. What is behavior modification? There is a learned behavior which is not good. You have to unlearn it and learn a new behavior. And the new behavior will have lot of, child will get benefit out of it. Positive stroke that we call. Okay, this is very important. The old behavior, you don't bother. For example, child is behaving bad. There are many methods. One of them is ignoring, just ignore. A small child, just ignore. Whatever you may make ruckus there, you don't listen, you concentrate on something. After some time, child will stop. But above 10, child cannot be. Because remember, below 10, you can change the behavior, but above 10, the child is intelligent. You may have to reason it out. So behavior modification become cognitive behavior therapy. You have to talk to the child intellectually at equal level, and the child will understand. Okay. Now, 2004 probably was a turning point for Adolescent when I was the national president. That's the time we started this commitment. Governing the executive board took the commitment that we are committed to look after you till you are 18. And that is almost the same time that there's a combination happened. Dr. Swati Bhave, who actually wanted, year before that, 2003, she wanted actually to do street children. Okay, myself and Dr. Kamath sat with her, reasoned out with her that it is much better to take adolescents, because I know her capability to take adolescents into, and because of that, she joined, left the street children and took adolescents as a major problem, and now she has taken it across the country as well as internationally. So she has great help. I was doing more concentrated research, and she has spread the message across the country, across the globe. Now, few words you need to know. So all my regard to Dr. Swati. And most important is we must realize few words. Advice is a bad word. If I start, I was in college 40 years ago. If I try to tell the child about thinking of my college days, what is right and what is wrong, they will literally laugh at you. Are you mad? What are you telling? Life has changed a lot. So advice is old, rotten. Don't give advice, but you can give guidance. What is the guidance? Guidance is what we do sometimes by ABC analysis. Make the child talk about the consequence himself or herself. You as a senior person, educated person, you can give some guidance. If you do better, it may be good. If you don't do, your problem. Negotiation, never do in marriage counts. I do a lot of these days. Actually, Sridharaman said, where is he going? I have gone much beyond adolescent. Now I'm doing young adults, doing a lot of premarital, newlywed, and marital counseling. I have gone much higher. Because my follow-up babies are 34 years old now. 87 August. Now they are 34 years old. So naturally, I have to grow with them. So I'm doing a lot of adult, and I'll go up to 50 years probably when we will start the healthy aging program. I will start before I disappear from the scene. Healthy aging. We already started the courses on that, healthy aging. Now let's look at negotiation. If you have a client, you only talk to the client. Not the husband. If the husband is a client, not to the wife. People tell you, sit them family counseling. Nothing works. You become the bad boy. If you have a problem with your husband, I will help you to how to manage that. If the husband has a problem with the wife, he must have a separate OP number. You come to me, I will help you how to set up with your wife. Never sit them together. You'll get into problem. Psychotherapy is what I was talking about, subconscious issues that can be done only by a psychiatrist or very well-trained clinical psychologist. Simply they use something like ab reaction. that injecting thiopental sodium and all, taking you to a trance and then talking to you a few things, or even other methods are there. But counseling is improving the personal growth. It is not advising, it is actually improving your personal growth. I'll come to that. What is counseling? It is not advising. Counseling do not solve all problems in life. Counseling is aimed at helping people make choices and act on them. This is the only word you should remember. You are actually helping a person to make his own, her own choices in life and act on the best according to after the discussion. So you are not doing anything. The client counseling himself or herself is doing. Counseling is a learning process. So naturally, after a good counseling 5 or 6 sessions, your personality should improve. Now, counseling, there are 3 main approaches. There are lots of details. I'll just stick to the main thing. Counseling, cognition means knowing. I like these three words. The basis of, whole basis of psychology is 3 words. You have behavior cognition, and feeling affect. Now, suppose after all this class, you tell me your class was useless, I will feel bad. Definitely, if I say no, it's wrong, I will feel bad, but only 30 seconds. Your feeling bad is only 30 seconds. Then quickly you must shift to cognition and then say, did I do the job well? Or did I say the same old thing? Did I give something new? Did I say something useful to the practitioner? You think again, and that is what is important. So cognition is the thinking process is cognition, and address cognitive dissonance, which means your problem. It is called, for example, if you talk about depression, they have a cognitive error in thinking. So your thinking become illogical, irrational, and unrealistic. 3 words: illogical, irrational, unrealistic. So that is why there is a cognitive dissonance, So what do you do for? You substitute that thinking with logical, rational, and realistic. And that whole process is called cognitive behavior therapy. Now they say affective approach. Affect means feeling. Now this is Carl Rogers' client-centered approach, where what we are saying is we try to eliminate the defense mechanism developed out of perception of threat, insecurity. We know that if you try to hit somebody, he will protect like this. Okay, that is a physical thing. Everybody will do it. It's a reflex mechanism. Just like that, you don't want to injure your psyche. Where it's sitting, I don't know. But there is something called psyche. And to protect that, you will take defense mechanism. All that defense mechanism. And you have to tell the person that what are your defense mechanism? Why are you doing it? Can you change it by a better method? Okay, defense mechanism. Okay. Then you have behavioral approach, cognition. This approach is very much character. One word only you need to unlearn the bad and relearn the good. And less than 10-year-old children, this is only what is required. This is only that will work. Unlearn the bad behavior, relearn the good behavior. Now, this is important. Core conditions for counseling. Number 1 is empathy, a sense of caring and understanding. Every Tom, Dick, and Harry, please, for heaven's sake, don't start counseling. If you are maybe good in so many things, you may be good in looking at EEG, ECG, echo, so many things. You are very good, scientific person. But that doesn't mean you are good in counseling. Counseling is a separate personality. You have to feel so much of empathy for the child. And I started counseling not by learning counseling. I only had to look at, if I see a child in front of me, I think of my own childhood at that age, think about what I thought. That is the way. That is putting yourself in the shoes of the other person. That unconditional positive regard. This is extremely important. This is extremely important. For me, no child is a bad child. No child is a bad child. Child has bad behavior or unhealthy behavior or dangerous behavior. This is what Jesus Christ also said. Don't hate the sin, not the sinner. Don't think that the child is bad. If you look at the child as bad, you cannot have empathy and you cannot be a good counselor. Third one is congruence. Your feeling, thinking, and action should match. A counselor should be congruent because your counsel is incongruent. They have some feeling, whole lot of feeling, thinking is different, and what they do is these three do not match. Your feeling, thinking, and actions do not match. So if you are coming to a counselor who also has problem, then you are in trouble. Okay? Then respect. Make only positive statement. They might have made mistake. Never even say you are bluffing to me. No, never say like that. You only want to say how much of the truth that you have said. And it's so difficult. You tell them that to a stranger to tell all your personal things are so difficult. Even I won't say. Okay? Better how much have you said? 10%? 20%? Suddenly they say no, 60%. Okay? Then instead of asking, did you say 60%? They will not do. You start very low. No, sir, 60% I have said. Congratulations. So good. In the first visit, you said 60%. I think you are a great child. Okay? Next time, we can further talk about it. Because you need to give him time to make sure that you will not convey anything what he or she has told to her parents. She wants that guarantee. So the crucial thing they will not say. They will say around it and test you whether you will tell the parents. So initially you must say, if you are going to planning to commit suicide, legally I have to tell your parent. Except that whatever you have done in life, I am not going to share with your parent. This is very important. Immediacy, direct mutual communication. That is important. Confrontation. Sometimes you may have to confrontation has to be done. For example, especially in marriage counseling, the wife is talking 100 bad things. Then you just make one statement, throw him out. Not worth it. No, sir, no. Suddenly they will say no. Confrontation is a method to see how far they will go. Then concreteness. Discuss in specific terms. Don't beat around the bush and talk philosophy. Most of the time, so-called counselors who are not trained counselors, see, for example, I'll give you a young girl who lost her husband newly married girl or young girl lost her husband in an accident. You go on telling, something bigger was supposed to come. Good that it went away like this. Something was going to hit your eyes, it went like this. Don't talk all this rubbish. Keep your mouth shut. Just touch the person, touch the girl, and just look in your eyes. There should be a lot of empathy. That is all what they think, not your talk. Don't say unwanted things. The minimum you say in a counseling, the much better the counseling situation. Self-disclosure. Rule is that you should not make self-disclosure, but sometimes it helps. A very resistant case, to convince the child better, I have gone through the same stage. So that's why I'm telling self-disclosure may be done. Okay. Now, what are the practical steps in counseling? I never recommend my life. I have never recommended any of my books, but this simple book I will recommend because I have not seen a book simpler than this on adolescent counseling from JP Brothers. That is the first time ever I'm recommending a book, because if you want to practice, you need some simple book. Now, what are the steps you need? Positive relationship building. How do you get a positive relation? You cannot write in the book how to get a positive relation. Every child, every girl, every boy has their own style. Sometimes, you may have to use many tricks to get the child on your side. Second is ventilation or catharsis. Ventilation means give them time to tell about everything. Don't be impatient. I have no time to listen. If you don't have time to listen, have an assistant, who is helping you with this, let you talk there. But the child or the girl or boy has to ventilate. That is same as catharsis. They have to tell everything there in their mind. Then you may try to pick up key elements from there and try to prioritize. So you will say that do I understand that 1, 2, 3, these are your major, you said so many problems, but what I understanding is this may be your major problem. Is it right? My priority? She'll say, no, sir, first one is other one. Okay, I said, great. So you discuss with the child, but then you're helping to make the child focus on 2 or 3 problems. Then what most important is you talk the roots of the problem. You have to get into the roots of the problem. You see a tree, but a huge roots will be there. What all has led to it, out of which most important is the client's own role in the problem. We all blame somebody else. We say she did like that, he did like that. That's why he got into trouble. Then you say, okay, I agree, I understand she did all this. But is it that you had no role in that? Is it possible? Maybe you also did something. Yes, sir. Sorry. I didn't want to say it, but I also did like that. See? So you make you understand that you also had a role in creating. Otherwise, everything is mother's problem. So that is simple. Context of the problem. What the problem happened in which context? The child has failed. He got beaten up somewhere. He had a lot of things, and then he abused the mother. Abusing a mother is unpardonable, no doubt about it. But in that context, even everybody will abuse. So you look at the context. That is very important, because another context, he won't do the same activity. And also context is important to make decision about solution. Who makes solutions? Client makes solution, because problem is his. The context is his. He only can say what are the solution, who all can be involved. Out of which your job is only to say, you said so many, can we prioritize 1, 2, 3, and which one will you give number 1, which one will you give number 2? Then you help the child implement the solution. Help the child implement the solution and termination of counseling. This is very important. Now help the child implement there is a very important thing, that is, the child has to implement, but you have to be with the child. That is very important. That Freud talk about something called transference. Freud uses the word erotic attraction of the counselee to the counselor, and I won't go into that level, but invariably the child will get a attraction to you. Suppose you are having a 20-year-old girl you are counseling, or 16-year-old girl, what she would say is, sir, last 16 years my parents could never understand, but 20 minutes you have understood me. And that makes a huge difference in the relation. That is because we are professionals, okay? Not because we are magic or something. It's a professional. You will be able to focus. So child has so much trust in you, that trust can be utilized to get result. Whatever you say, the child will do. This is called transference there. But never develop counter transference. That means affection for the child beyond the professional level, because counseling is a professional relationship. It has to be kept at professional level, whatever be the circumstances. If you think you are getting attached to that person too much, then refer to say that I would like to send this to my senior colleague. But never take it up. You will get into trouble. Now, effective counselors are usually personally integrated and self-aware. They do not have too much of family problem. They don't have too much of sexual problem. They do not have too much of professional problem. They are little more balanced persons. I have done all this, and senior pediatricians above 50, 45, 50 are the right person, because they're hurried to make things all have gone. They have made some money. They have made the house. Children are reasonably well off. That is the time that I want to give something to the society. That's the time. Value the client as a unique person. Every client is different. Remember, every client has unique features. You cannot say he is better than this person, that she is better than. No. You have to accept the person with all the good and bad. Then identify hidden shame, acknowledge, repress, or defended against. Most of us, I'm sure, if you dig into our life, we must have some hidden shame. In childhood or adolescence, or even as an adult, we would have done something for which we have a shame. And that should be. If you can identify that hidden shame, acknowledge it, and it is two ways, suppress and repress. Suppress means just like that. Repress is like soda bottle, old type soda bottle. You put your finger, oh, the goalie will come up. That is repressed because under heavy pressure. So most of the things that is suppressed or repressed can be brought out. Then client revelation must be protected from therapist's personal reaction, especially rejection. Because the client said something, the child said something you don't agree with, don't show reaction. Because that's why I say before entering into a counseling situation, you must do an action like this. Put into a pocket. What are you putting in your pocket? All your attitudes put into your pocket. The attitudes is for you, not for the client. Client will have his own attitude. Don't try to give your right and wrong to the child because already they are coming with a lot of baggage. Baggage means from childhood, people have told this is right, this is wrong, all that. So they already have so much of baggage behind and they are walking like this. And now you also put your own ideas. Never do that. And have empathy towards the client. All the time, have empathy towards the client. What is empathy? Empathetic rapport means accurately sensing and being able to see the client's world they do. For example, depression. When you tell them better, you are really suffering. The way you say suffering should be long. You are really suffering, I know, sir. True. Nobody told me, nobody helped me. I don't know why I'm suffering, but I'm suffering inside. The moment you say that suffering in that tone, the child understands, okay, this man has understood my feeling. That's very important. Communicative attunement, verbally sharing your understanding with the client. That's what I said. Even when you say suffering, I know you are suffering, suffering. When you say like that, they understand, oh, there's so much of attunement into it. Therapist senses accurately and communicates to the client the feelings and meaning of experience. Instead of say, I can understand. Most people say, I know, I can understand. When you say I can understand, you're not understanding. Just like a poor teacher, bad teacher, when you teach, hope you understood, keep on asking means, even he knows that the students have not understood. Instead of that, say such words that make them feel that, yes, he has sensed my tragedy. Cultural empathy includes context and society. This is very important. Cultural empathy means we get people from different societal groups who already from birth have been suppressed or repressed and all that. When you talk to them, when they come to you who are sitting with a big house, AC room and all that, they already have a cultural problem. And don't increase that. You treat them so nicely that they feel that, hey, this man actually understands me. Okay. Then therapeutic relationship, where personhood of therapist is a key factor. How the person is. He should be a person, young looking, energetic, and really the child must understand this fellow knows. So you talk to them something about their college things, school jokes, current jokes, and all that. They look at it. Hey, this fellow knows all this. So he is a person I can communicate with because he understands our own jokes, our own silly things and all that. Don't think that you are a doctor, big person. No, child actually wants somebody like a little friend, but knowledgeable. Effectiveness related mutual respect, caring and trust creating. That's very important. Child must trust. First visit, if you say anything to the parents, next time they won't come. But if you have not said anything what they have said and it's very bad thing, next time they trust you so much, they come and tell more things to you. Client willingness to act and achieve a positive outcome is based on his or her view that the environment relationship is safe. If you know the environment is safe, they will be with you and they will be your partner. Now, little, science into it. What are the issues? How do you have adolescent mental health problem? One group is unresolved childhood disorders. For example, child may have had contact disorder, hyperkinetic, ADHD, autism, specific learning disabilities. The major chunk of it has gone, but still the leftover will be there. That is one group. Second group is, of course, related to puberty and adolescent because they have a new thing. Till yesterday, they were a free child. They could do anything. They didn't have to bother about everything. Now something called sexuality has come into it, and that is creating a lot of problem to the child. Don't know what to do. Can't tell anybody. Can't tell Amma. Can't tell the father. Papa, you can't tell. Friends, maybe you can tell, but they frighten you. Oh, you had that very bad. Be very careful. And Indians have a particular habit of everything say, be careful. What do you mean by careful? Hang upside down. What is careful? You must tell what you should do, what you should not do. Don't say be careful. It's a whole lot of adjustment reaction. That is the second group. The third group is the major chunk of it, adult type disorders with first appearance in adolescence. So you have anxiety disorders, which may be generalized anxiety. Every moment you are anxious. You are an anxious person. Everybody can look at you and say you are anxious. You have phobia, fear gone out of proportion. Now, too much of fear is not phobia. Remember that. Extreme fear is not what phobia. Phobia means the stimulus may be small, but your autonomic reaction to it is huge. Get the point? That is phobia. It may be a cockroach, which reasonably cognitively you can say cockroach will do nothing to you, but your reaction to that cockroach, autonomic reaction is huge. That is what phobia is about. Panic attack. You're okay sitting there, panic start coming, go up. It will go away by itself. But you are waiting for the next one to come. So that means you are stressed all the time, panic attack. Then OCD, very important, obsessive compulsive disorder. Obsession in thought, compulsion in action. This is extremely important. This has many, many manifestations. Okay, I will come to that later. Post-traumatic stress disorder. When you have flood, we have cyclone, you have all this problem, then few children cannot. What is happening is, I'll show that later again, that is the memory poke into your head, pierce the head into your head. You try to forget, you can't forget. So that creates autonomic reaction, you become upset. Then you have depression, substance abuse, psychosis, and personality disorder. Now, if you have a choice of marrying a psychosis patient and a personality disorder, heaven say choose psychosis. Okay, because when he is treated, he will be fantastic. And after treatment, he will be so thankful for your support. Whereas personality disorder makes such an image to the public as a fantastic person, only the poor wife will know what he is. He will be best in the party. One come home, he will behave entirely opposite. So basic of evaluation adolescent, you can use basic. You look at the behavior, affect or emotion, somatic symptoms, interpersonal relationship, and cognitive. You just remember basic, okay? Then most important, the whole, naturally a pediatrician cannot learn the comprehensive psychiatric textbook. It is foolishness to do. But we should be able to do simple way. How can you identify? And this is what, 3 rules only. If the symptom is out of proportion to the cause, that means I am feeling suffering. I have no reason to feel anxious, but I am anxious all the time. I have no reason. I'm looking at why am I sad? I have no reason, but I'm sad all the time. That is symptom out of proportion. Then the second one is definite body symptoms. Definite body symptoms may be in depression, lack of sleep is disturbed, appetite is disturbed, and libido is reduced. Libido means sexual energy. In a male, it is very obvious. How many times you used to do masturbation? Oh, many times. But now 6 months, no mood. Girls, it will be difficult. But boys, it will be very easy to do. So then third one is avoidance. Avoidance means that because of your body symptoms become so severe that you are not able to do your job. That is the most important part. Then this is the questionnaire, and in which you say, have you ever felt anxious, sad, etc.? Do you feel symptoms out of, same thing what I said, palpitation, sweating, appetite, sleep disturbance. Then 3 things you must know. You are good for nothing. You are good for nothing. Worthlessness. If you are a depression, 3 words, worthlessness. You are good for nothing. Then there is no future for you. Hopelessness. Remember 3 words. Worthlessness, hopelessness, and life is not worth living. And there is something before that, helplessness. 3 words. Worthlessness, hopelessness, and helplessness. I can't do anything. That feeling is important. Naturally, you will say life is not worth living. You think of suicide. That's important. And using this, I must tell you, we have used it on 1.5 lakh children across the state, And we collected the best out of that, collected about 75, which is complete by all means. And we are just going to publish this. What is the status of the children in Kerala? Now, again, I'm saying post-traumatic stress disorder, there is a catastrophic trauma, and then you have intrusive recollection, okay, of the event. Then you have autonomic arousal, and patient goes into avoidance. Obsessive compulsive disorder, obsession in thought, compulsion in action. Now, depression, then you have three problems. One is cognitive error. I mentioned it. What is a cognitive error? Three minimum, so many cognitive error, but three you remember, overgeneralization. Somebody said, good, didn't wish you today. Oh, he also didn't wish me. Means I am no good. See, nobody mind me, nobody. You have a small incident, you spread into all areas. That is called overgeneralization. Second is maximization of negative and minimization of positive. If you ask anybody in India, tell me three good things about you, they won't know. But say three bad things about you, they will talk. That is called maximization of your negative, minimization. And the thought process, I said, irrational, illogical, unrealistic. I said it before. And biological symptoms, sleep, appetite, and libido affected. Okay, now there's a whole lot of studies that I have done on normal adolescent, not anybody with complaint. Simple 500 normal adolescents in the community, randomly selected by a good research methodology. What we saw was 14.4% had anxiety disorder, and almost same as severe, almost same group had depression. Concurrently present in 24% adolescent with anxiety disorder. 14% had anxiety disorder, and around 25% had depression. Fortunate, and as severity of anxiety disorder increased, severity of depression also increased. Now, the fortunate part is the drug of choice for anxiety disorder and depression both are same. And you never get a pure anxiety or pure depression. Mostly they come together. You have a child, I still remember a child will come, he's not eating, he's become thin, his face is like this, he's not sleeping, frightened, anxious, So that drug of choice is fluoxetine. I will talk about it. Okay. Then you have the biopsychosocial model. What is the biological model is there is some problem in the chemicals. Just know chemical. You don't have to know all the details. And that has to be corrected by drug. You have a cognitive error in your thinking that has to be corrected by cognitive therapy or cognitive behavior therapy. And you have the social part, support of the family, teachers, and friends. And the therapist or the counselor. You have to be supporting the child so much, then only you will get result. Biopsychosocial. Now, cognitive behavior therapy is, actually identifying your irrational, illogical, unrealistic thought and giving a suggestion to the child. Can you think differently? I am socially awkward. So you feel anxious. So the teen sits in the corner alone while at a party. Now, instead of that, you can give an alternative. You really have to work with the child. In a busy OP, you can't do it. There has to be a psychologist with you. There has to be a counselor with little bit at least trained in cognitive behavior therapy. Then only you can do that. Transference, counter-transfer. I said it earlier. Then drugs, substance abuse. I do not have much experience in substance abuse. So no point in me talking much about it, but these are the drugs normally that is seen. And most important cause is availability, celebrity influence, lack of self-motivation, peer pressure, poor family dynamics, and faulty influence of the family. So I think this sentence is important. Availability is very important. Poor family dynamics, the way family work, that is important. Then you have three things. This you can note down. Substance abuse consequence, they have irritability, inattention, anxiety, and suicidal ideation. This is very important. Inattention in the class, irritability in the class, anxious look, and they may be having suicidal ideation. Then, of course, the most important condition called psychosis. So in the class, I always say, how many of you are mad? So some will put up the hand. So I guarantee that you do not have madness. Why? Because the first problem with psychosis is that they do not have insight. They do not have insight. Okay? The very fact that you thought you had psychosis or you are mad means you have insight. So you cannot be having it. A psychosis person doesn't have insight. Instead, they have hallucination, seeing, hearing, and spelling things which are not there, or having delusion, unshakable false belief. Then, of course, this I'll spend a minute on this. Please take this drug. It is published in Indian Journal of Pediatrics. Myself and Professor Paul Russell, after reviewing all in the literature. See, if you have ADHD, atomoxetine is really good. If you have anxiety or depression, any type of anxiety or depression, fluoxetine is a drug of choice. Anxiety 10 to 40, depression 10 to 20. Escitalopram, anything you can give. Most people, psychiatrists may use it. So don't bother about what all drugs psychiatrists use. You only focus on one drug, become familiar with it, and you have no problem. Don't start with 40 milligram. Start with a lower dose, keep increasing. It has to be once with the breakfast. There was a lot of fear that this may provoke suicide tendency. No. What is happening is when the drug is there within 2 weeks, your energy will come back, but depressive mood won't go. So that means a severe depressed person will not hang himself, because for him hanging is like climbing Everest. But when the psychomotor energy increases, then he has the energy to do it. That's why it happens. So parents need to be little careful. That's all. Mania should not try to use it. Mania is depression on one side, bipolar. Mania is the other end of depression. When you have depression and mania, then you call it bipolar. You should not try to treat it, but in a place where you could not get a psychiatrist, carbamazepine is very good because we all use it as anti-epileptic. So you are familiar with it. Contact disorder, again carbamazepine. And psychosis, only drug is risperidone, maximum 2 to 4 milligram. In adult, small children, less than 2 milligram. Even drops are there, Risperidone drops are there. So if possible, consult a psychiatrist. But if you're in a situation where you cannot consult a psychiatrist, you may use these drugs without any problem. It's been published in Indian Journal of Pediatrics. There's no problem. Nobody will blame you for using it. But even after 40 years of experience, I try to consult a psychiatrist. The reason I will tell you, any of these children, if you commit suicide, then if a psychiatrist prescription is there, it is up, everybody agrees. Society agrees that, okay, he was under psychiatrist treatment, he committed suicide. But if it is only under the pediatrician, you have a risk. So it's in your own safety that you refer to your friend psychiatrist, say, have a look at it. I will follow up the child. In fact, random, that's what happened. Psychiatrist spent 5 minutes, but he will write the drug. I have a prescription of the psychiatrist. Then I can spend any amount of time with the child, counseling the child. So it is for your safety that I'm saying. Now, then you have teen screen questionnaire. This is published in Indian Journal of Psychological Medicine. This is same as what I said before, but in a little more detail, because each question denote what sort of problem. I won't go into detail of that. This is the same thing. This is published there. And now what I am doing is the problems in premarital and newlywed counseling. And I must say 2 examples I must say. One, my experience of a girl, class 11 child, whose the complaint was, principal said was, whole night she is seeing blue movies. Girl? I said, is it boy? No, girl. The whole, teacher thinks she is a bad child. Okay, because she is seeing, every night, whole night, and she goes to sleep like that. To me, there is no bad girl, so I had no problem with the child. I asked her only one question. Do you do self-stimulation? She said, no. I said, hey, you know what it is? Yes, I know. How do you know? Your friends always talk about it. I never done, never. After seeing all these, sex movies, you never felt like? He said, no. What is the diagnosis? It is OCD. obsession. Somehow she saw once that became an obsession in thought, compulsion in action. So I told the principal, refer to the personal psychiatrist. Within 6 weeks, she called me back, said, sir, the girl is very good. This is one thing. Second, again, OCD, I'll tell you, a girl who had come to me for premarital counseling 2 weeks after marriage comes, and she tell me that, sir, I want to talk to you. Why? I said, come with the mother, because that's my dictum, only with the mother. She said, no, I'll come with him. I said, what is the problem? No problem, except that if she touch me, he will go and take bath. Touch means they have sex or something. Am I such a dirty girl that he has to go and take bath every time? So I asked the same question. He's very meticulously clean. Oh, sir, clean, 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 clean. I said, this is OCD. Don't bother about it. Okay, do you need drug? I said, he can manage without drug also. Then it's his problem. Let him take bath. It's not my botheration. You understand my point? So those 5 drugs that I've said, please keep in mind. That will be very useful in your practice. And 3 message I will tell you. If you don't have the energy, the feeling, empathetic feeling, don't start counseling. It won't succeed. That is number 1. Number 2, you have to fix time for that. No disturbances, no phone call, not busy. If you are a busy pediatrician, don't try to do, keep 1 day only for counseling. You are not available for anything. That is the second thing. And third one, always have a psychiatrist as your friend, because he also is happy that he only need to spend 5 minutes, 10 minutes maximum, and he get the money out of it. So he is also happy, but you can spend all the time. Personally, that will be a safety factor for you, because by any chance the child commits suicide, you will not get into trouble, because already he is under psychiatrist. Thank you very much. And the next thing I'm going to do, what we are doing is the premarital newlywed counseling. That is a subject. Now there's a huge demand for that in IAP as well as locally for talk on that. We will do that. Thank you very much. Sir, over. Sir, over. Kusum.
Yes, sir. Shall we start with questions?
Yeah.
Sir, first question, what is the most common issue regarding sexuality you have come across in your clinic?
Most common is naturally related to masturbation. Whether it is boy or girl, you just need to tell the child, from the time man was born, everybody has done it. I don't want to name, but even the bigger, so-called big people also have done in their childhood. Don't bother about it. It is like passing urine. Don't keep account of it. Don't feel guilty. I pass urine 5 times today. Oh, do I feel guilty? Don't do that. Just take it as normal thing. When you feel like, do it. But jokingly, I tell them, but remember, you only have one. It has the last 50 years. So handle it little carefully. Don't overuse it. That's all. Girls, you may think it is not there. I think minimum one third of girls have it. Don't make them feel guilty. If they are not married, tell them don't put finger inside, only use the clitoris. Do it if you want. Don't tell anybody, it is your private. If you want to put your finger, you want to lick your finger, it is your private. You don't have to get a government order for that. Just do it like that. That is the masturbation. The severe one, most severe one I have seen, I tell you, and that's a very important one. A girl who was brought, what she was doing was, she was, showing in the video. It's nowadays so easy. She will pull down, the boy will lift up, both were doing, to a boyfriend who spread it around the school, became a big issue. Principal caught everybody, told the girl, showed the photo picture, is it yours? She said yes. She gave me a slap and said, why you want to own it up? It's not yours. Your face is not seen. Better why you want? Because she was mother. And then she called all the boys, told them POSCO Act and all that. I'm going to call your parents. I'm going to put you all, police is coming, all that. She frightened not out of them. Made sure that the last person with whom it was shared was also taken. And then she said, okay, this time I will let you off, because the girl has no complaint, father or parents also have no complaint, and it's only showing something, so she did it. But when I talked to the child, I said, do you feel guilty about it? She said, no. And nowadays, most children say no guilty. Guilt is not their problem. Will you do it again? She said, I can't say no. Then I had a problem. On the phone, I called Paul Russell in Vellore, made him talk to the child. After 5 minutes talking, he said, she need to come to Vellore, spend 6 months for psychological reconstruction because he has personality disorder. If you leave her alone, she will get into trouble for sure. Any amount of counseling, any amount of spiritual talk will not help. She has a personality disorder that need to be treated, and treatment is very difficult because it's called psycho reconstruction. It takes 6 months. Even then, there is no guarantee for result. This is the worst case I have seen. Thank you.
Sir, if a teen is brought to you and the parents are complaining means they are giving history that the child has not got enough self-confidence or self-esteem. So it is very easy to say that it should be boosted up and it should be increased. But what are the ways we can explain the parents? They can do it at home. How to increase the confidence of children?
I talk to the parents, I talk to the child and tell the child that beta, I am not telling you what is given in that standard textbooks. I will tell about myself. As a school child, I was worse than you. And it's true. I was worse than, I tell my story, how systematically I improved and reached this stage. I think that is the best way to convince a child. But don't tell the parents. They may go around tell people that he was like this. No? But the child understands the sincerity with which you are saying. Your own example, better we go through all this problem. The word I love in Hindi is better. Whether it is for a girl or boy, it is a fantastic word. So much of affectionate word. You can use it even to middle-aged people. Sometimes I use. Because when I feel so affectionate to them, I use the word better. And they fall for it. And tell them 1, 2, 3, 4. What are your problems? How can you get rid of it? For example, I was a person who could not. No, none of you will know this. I was a person who could not, stand and talk in a crowd. Okay, my defense mechanism at that time was, I will sit only talk. I said, why you are sitting? I get concentration only if you sit. No, actually the problem is other. When I tell this to the child, they look at you like this, sir, is it true? I say, yes, sir, it is true. You have to grow. If I can become what I am today, better you can become. And sit with them one by one, how to get rid of, get over the problem. You must have made problem with girls. You must have had difficulty with this thing, all sort of thing. I'm sure. See, I tell you, as a counselor, you don't have to learn psychology. You learn 3 things. Do not bluff to yourself. You can bluff to other people. You can pretend to other people. You can behave differently when you are a VC. How you sit in the VC chair is all different. But when the client comes, be truthful to yourself. Whatever good and bad and filthy that came to your mind, think that if that can come to your mind, why can't they come to the child? Secondly, you are willing to share some of the thoughts, not everybody, but real in good cases where you may have to say that. Thirdly, you also, sometimes the parents are not supportive, then you need to talk with the parents and take out some of those things that they have. Tell them that you have this problem. You're not able to manage like this. You're not able to manage things. How do you expect a child? And I usually tell them, if I can't hear, what will I do? When you are speaking, I will do like, I'll do. If you give me a slap, will it help me? It won't help. Instead of that, okay, if you understand, don't even say. If you understand that I'm not able to hear, you talk loud, come little closer. So that sort of empathy is what is required. That's all.
Yeah. So, can the counselors be involved in breaking bad news? Suppose a life-threatening diagnosis has to be disclosed.
Little trained. And if you look at Paul Russell, just type his name. He has published very good articles on Paul Russell, CMC Vellore. Just put his name, how to break bad news. He has published articles on that. Grieving and breaking bad news are serious topics. We need to be prepared. In fact, what Adolescent Health chapter should start doing from now onwards is not general talk. Take specific issues and get the best expert, not the loud person. Because why I'm saying this is because the problem nowadays is You have, internet experts, experts who can take, PPT from the internet and start talking like authority. No, there may be somebody in the remote place who actually is not a known person, but who is doing. For example, when you talked previously, I felt some expert you were talking. I forgot what it is. I really wanted his name. Somebody said about an expert in Jaipur in something. I'm forgetting what it is. I was looking for his name. I forgot to write it down. I need such a person. You understand my point? See, many of you have been my students, but I'm sure you have grown so much. You have specialized in areas which I was not able to teach you. I am willing to learn from you because you are the expert now. I can be a student back. That's how I learn. So AHA should focus on such, for some grief, how to break news. One program is only on that 3 hours. And you get 2-3 experts who have either published or has been doing it. And Paul is a right person, I would say, Paul Russell, to break some of these things. Okay.
So can you repeat the name, the book from?
No, Dr. Paul Russell, you put in the net, you say,
Okay.
Breaking Bad News. It's an article. It's an article. Breaking Bad News. Because they do it very well in Vellore.
Okay. So what are the pointers? What are the signs of good relationship between a parent and child? When they come to your clinic, you can make out by their body language or some signs that they are at good terms with each other, or
See,
they are not.
When I was talking, you saw my grandchild on my shoulder.
Yeah.
I didn't say anything. But when she was shouting and saying something, I said, no, don't do it.
Yeah.
Okay, she understands. Relation is where you perceive the need of the other person, whether it is between husband and wife, father and son, or the mother and son, or anybody, or brother and sister. If you perceive the need of the other person, and if you do it, one small thing when he was so troubled, they won't mind any sort of bad behavior from you. Tomorrow is your exam. You know you are all tense up. You are ready to fight with the mother, and you start shouting at her, use bad language, all that. That day she keep quiet. Better, can I give you coffee? Can I do this? Children understand that she understood my stress and she is doing that. This is exactly what you have to do with your husband also. This is exactly what you have to do. See, in public, we talk big thing about people. Don't say all that. You don't have to keep on saying goodness about that person. Just say one thing that he has done. When you were in trouble, he did a small favor to you. And you just mention that, I think the man will melt. The other person will melt because you are still remembering that also. Okay? Whereas if you say he's a good man, he's like this, he's like that, most people know it's all bakwas. You are just saying for the heck of saying. But remember small things in your life. Okay? When somebody said as a teacher, I think Swati said it. Something as a teacher. That word that she remembered me as a teacher, that is heartening to me. Rather than she said big things about me. I am nobody. But in her mind, she still has an affection of me as a teacher. That is probably much higher than any other good things you may say about me. This is the way you can tackle children. Never show off things. Second thing is, don't be like the mothers who keep saying, I carried you for 10 months. Okay? And here some child told you why there was no CATU those days. CATU means head load workers not there. Why couldn't you get help? Now, don't irritate children by saying all the grand things you have done for a child. It is your duty that you have done. Don't try to, somebody else can say it. Papa can say, how she suffered when you were born. She was under bed rest. 9 months she was bed rest with the foot and race. Papa can say it, but not the mother. You understand? Somebody else can say, you are talking badly to her now. Look how much she has suffered for you. See how much she has done for when you are down in the examination. And sometimes you are so tense about the exam. I have done it for my children. I have done it. He's so tense. I said, Papa is not going. I'm not going to office. I'm going to sit here and pray for you. Now that idea that you are, and when he come back, you are in the puja room. That is the greatest way you can tell a child, you are the last for me. Anything I will do. I may be any position, doesn't matter. But to me, my child is most important. That affection you have to say.
Thank you, sir. Sir, Dr. Priyanshu Mathur has got few questions for you.
Yeah, please.
Dr. Priyanshu?
Thank you. Thank you, sir. This was a really excellent talk, and you explained everything in such a well manner that it's very clear. There are few questions. There is a question by Dr. Geeta Patil that is girl 16 years old, studying very well, but watching pornography and dreams about murdering parents. How to tackle? Already that patient is referred to the psychiatrist and she is refusing to follow.
You see, here there is a pathology. If the child is seeing little pornography, it's not a big pathology. Okay? Yesterday, somewhere I said this. We all talk in public about how pure we are, but only your wife know how impure you are. Get the point? Or the husband know how you are. So let's not brag about our purity. But a 16-year-old child saw some porn clips. It's not a big issue. But you can take it up and say ABC. What are the consequences? How it is going to affect your studies? How it is going to be affecting your relation? How it is going to be in future? It can go to be a problem. But what can I do for you? Can I help you? All that. But here the problem is she's watching how to murder parents. Then the problem is something else. This is a psychiatrist with the help of a good clinical psychologist has to get into the subconscious mind of the child. Okay? Because I'll tell you, sometimes this can be very serious disorder. Sometimes it may be, for example, nursing students, MSc nursing students or teachers now who are completed, now they are teachers. I ask them a simple question. How many of you have thought of really wanted to murder? Not that you're going to do it, but at least you really wanted to murder your teacher when you are MSc student. I was shocked. More than half put up the hand. I'm reminding them that your students are thinking of you like that. Be careful. But that is a thought. That is because frustration. But this child definitely has psychiatric problem. She need drug. She need real, not counseling, psychotherapy has to be done in a center where they have the facility to follow up, admit and do. It's like if you have a severe heart problem, you say come every day to OP. No, you will be admitted. If you have a serious diabetes, something like that. It has to be admitted. It has to be treated by a team of 3 people, psychiatrist, clinical psychologist, and psychiatric social worker. In a small clinic, you can't do it. She has to go to a bigger center. Because not watching porn, but the other thing, if she focusing on watching porn, how to kill their mother, there is a psychiatric problem. Simple as that.
So there is one more question by audience that can you kindly suggest any hands-on counseling training courses we can pursue either online or offline?
Okay, Kerala University of Health Science, Kerala University has been conducting, when I was the director of CDC, the course in Child, Adolescent, Family Counseling Certification Program. There was a break in between for 5 years. Now they have restarted the program. Indian Pediatrics, it will come in Indian Pediatrics. You can join now only 20 days. You have to come. Sort of little bit practical training also you get, and you can do that. And our Kerala University of Health Science is just planning to do some certificate program, but of course that may be only for their own faculty. So the Kerala University course on Child, Adolescent, Family Counseling, I'm sure some of you might have attended. You only need to be a medical graduate or health science graduate, not even PG. You can attend that. Okay.
So the next question is, how can parents do counseling of an adult girl who is addicted to use mobile and doesn't want to consult counselor and think that she is not abnormal?
The little fellow who was sitting with me, actually at this age, her mother is not here. She is in Delhi. So naturally, we never wanted to be bad to her. So whatever she demand, I'll do. Morning, she tell me, Pupa, bring this to me. I will do it. Because, she always, we feel that she's without the mother. But this mobile became a big issue. Okay, she's actually started having addiction. The father became tough. He said, nothing doing, only in the night and all that. But what we did is, how half the dining table we converted into, we put a different kind of very colorful sheet and all, rubber sheet and all that. And she likes drawing. We got all sort of thing. I told her the whole house, I'm going to decorate it with border. What border you want? The whole house I am going to put all your this thing. She said, the good ones, I said. So bad one, what will you do? We'll put under the stairs. She doesn't want to throw away the bad one. Now actually completely gone. This won't work with an adult girl. I can tell you. This won't work with an adult girl. But the principle is still same. A biopsychosocial. If she may be given drug by the psychiatrist, psychologists will look into the reason why she is getting into this, and the parents give support and hope for the best. For everything, God's grace is so important. I believe that God's grace is so important. So if all the four comes together, this child will be better. But not just by a pediatrician, busy pediatrician giving little counseling, this girl won't go. You must not try also. Okay.
So one more question. How to counsel an adolescent in the COVID era, as they are having obsessive compulsive disorder of sanitizing their hands repeatedly and changing clothes and even changing bed sheets when they are not going outside the home?
Little difficult. The reason because neither you can have repeated sessions nor you can engage the child in any other activity, because always it is engaged into some other activity. But this is standard treatment is systematic desensitization. The principle is systematic desensitization to that. It's like a phobia. Take it as a phobia. Phobia for what? COVID phobia. Okay. And the steps I will tell you in a way, different way. Suppose you have your fear of dog. What do? 10 steps you take. When you see a dog, you get huge, this one, autonomic reaction. And that reaction going up like this called subjective unit of distress. The first time you talk about dog, you hear about dog, it will go like that. Second time, little more. By the 10th time, it will become flat. Nothing happens. You talk about dog. Then you show a picture of a dog so far away, standing. Same thing, repeat. Then you show a dog so far away. Then you show a dog somewhat near, then near, like that. So 10 steps every time. Initial subjective unit of distress will go up, and then when you repeat it will come down. Same principle can be used for COVID phobia also, but not easy because we don't have the mobility to do that. It is a difficult situation. Only thing, we hope that vaccine will come. And anyway, it's another 1 month, it will come, it will go away. It's difficult, actually difficult. Because you also don't want to have so much interaction with the child.
So now the last question, what is spirituality and how it affects sexuality?
I always say spirituality is the other half of sexuality. And yesterday we were discussing the same thing. The only place where you are totally nude is during sexuality. Now, when I say nude, you think about the clothes. I'm not talking about physical clothes. That may or may not be there. But your emotional clothes, your psychological clothes, all think about inhibition that you have. You must have lived with a woman for 40 years. Still, you are not opened up yourself to her. Neither has she opened up. That is what I say, cloth. Cloth is not physical cloth. Psychological cloth, emotional cloth, you are never did. But only during sexuality, you actually, most people open up completely. Otherwise, you are a professor, you are a very serious man like Sitharaman has become nowadays. Sir is sitting very serious. He has a very laughing type. Now he has become very serious, senior man. You understand my point? All that bakwas will go away only during that sexual act, provided you are doing with a person that you have faith in that. That is why in tantric literature, they say the height of this, and that is Osho also said the same thing almost. that your real innate self will come out during sexuality, and that is the best human relation that you can ever have. Okay, and that also has three parts. We know there is a procreative sex, recreative sex, and emotional sex, whatever it is. So I say the end point of physical sex is orgasm. The psychological sex is ecstasy. Ecstasy is like, after so much of pain, the baby is out, mother looks at the baby and she forget all the travails. That is ecstasy. And third is fulfillment in old age. But this need not be in old age. All three has to be even for youngster only. Only thing is young one. The physical part is more important young age. Older age, the third part is important. Only advice is, for heaven's sake, stop feeling shy of sexuality. God has given you this with a purpose. If you don't use it properly, you are insulting God. If you use it wrongly, you are insulting God. And I have the right to say it because I believe I am 99.9% clean. I never said 100% because 100% is only God. But even at this stage, I can say with real grit that I am 99.9% clean so far. Tomorrow what happens, I don't know. And how do I prevent something wrong? Taking precaution. This is important. Taking precaution. You think that you are not God, you are a human being, you are capable of making mistake. And I will take precaution at every step. You will never get into trouble unless you are destined to get into trouble. So sexuality is spirituality because, actually those who are at my age or even little less, now understand that, when you were younger, your antenna was very sharp. It is picking up all sort of things. Now reaching a stage where antenna is become old, antenna never pick up anything. You are realizing that your partner, how frail, how silly she may look, she is probably the only solace in your life, other than your arm, to put like this. There's a saying that the only person you can trust in this world is your own arm, because that is the only one will give you last moments of your life some solace. So similarly, your partner is the only person. And especially I'm telling to men that you always try to say that she is silly, useless, not educated, she is not smart, she is not this, she is not. The person whom you try to belittle whole your life, she is the only one that is going to be with you. All your patients will forget you. All your students will forget you. Don't think that they all will be there. Even your children may not be able to come. They will say, how can I fly from Atlanta to here? Because father died, keep it in the mortuary for 1 week. Let me think. You understand? But your partner will never ditch you, in spite of all the bad things that you have. And that is the importance of spirituality. Spirituality is like start seeing God in your own partner. That's the most important part.
So one last question.
Yeah, please.
Sir, regarding behavior therapy, the replacing unrealistic, irrational ideas or thoughts, it is meant for particular stress, anxiety, depression, or all of them?
You should do it two ways. Below 10 or 12 years, it is a simple behavior therapy where you are asking the child to unlearn the bad behavior and help him to learn new behavior. That is simple. But after 12, when the intelligence of the child is much bigger, you cannot do that. You will do cognitive behavior therapy, where you sit logically you sit with the child. Okay, somebody said like this, what is your response? I said, shouted at him. Okay, good, we all do that. But could you have done something better? Suppose you didn't shout, what will happen? Then nothing would happen. So is it better to shout? See, I'll give a simple example. A casualty patient comes. All of us have been house surgeons and all. What is the standard rule? Whatever time you come, you will scold them saying, why didn't you come early? Recently it happens, somebody shouted the child. So he said he fell from the coconut tree 5 minutes ago only. How can I bring early? You understood? It's a learned habit. But if one batch of house surgeons take a pledge, we are not going to say this. We are going to receive them with a smiling thing. Whole thing will change. How patients will adore you. or a gynecologist, I always say, under heavy stress, heavy, no doubt about it. I have all my sympathy for them because they undergo, babies, everything is perfectly okay, but at the last moment, baby is not coming out. I can't take him for cesarean section. I can't do anything. Something you have to do, get the baby out. So they undergo stress. So naturally, they will behave in a different way. Okay. But I have seen my own professor, whole day she is working 12 hours. Still at 7 o'clock when she is about to go, somebody comes, she will say smilingly. And that smile keep her mental health better. It's a bad learning behavior that we make excuse for getting angry because the other person will take it. But if it's a policeman, even a constable, we won't do it because you don't know. He may give you talk like this. For 7 days, nothing you will hear. And children do it with mother, not father, because mother will take it. The person who love you maximum, you actually go with it. Okay, so that's the thing. So they say a whole lot of sexuality is not something to be ashamed of. Sexuality is an energy, life energy. And again, last word, Freud, when he talked about sexuality, he never said about physical sex. He was not talking. Sexuality is a libido within you. Even at this age, if I'm taking a class to a group of young girls, you have a thrill to take the class. There's no sex in that, but there is an energy. If I am taken to all old people sitting like this, I won't have that energy. So that is what Freud said. It is an energy that make you do things in life, that bring life into you. And that is what is most important.
Thank you, sir. Thank you, sir, for answering all our questions very patiently and in a perfect manner. Thank you so much, sir. Sir, I invite Dr. Chawla, sir, for the concluding remarks.
This was very nicely, diligently presented, and every question, it was very well answered. So I'm also thankful to Dr. Patni sir, IAP President, Jaipur, Dr. Gupta sir,
I want to say
PHA
hello to
President.
Patni. He's my old friend, Patni. Sir, if he's there, my namaskar to you. Continue, sir.
Sir, one or two questions. Are you here?
Yeah, I'm there.
Sir, first of all is...
If the boss asks, how can I avoid it? I have to answer.
Sir, thank you. You had kindly elaborate about the primary counseling because you had shared with us about the secondary and the tertiary counseling. I want when the child is with us, since the birth of the child, we are following the child. Then at which level we should give counseling to the child? Second is, what is the parental counseling, how the parental counseling will help the child in preventing the diseases? These are the 2 points.
So nice question. Actually, in fact, you are saying little more than counseling. It's a parenting that you are talking. The counseling part of parenting. I will tell you by my own example. My 2 boys.
This is a counseling of the parents.
Understood.
For example, one child, people are going, they are going outside because the trend in India is to go outside. To go outside, Canada, US, anything. They will come to you, kindly counsel my child regarding what she will do. She will prevent the sexual abuse and other things. Number 1. Second is, there are many other problems. Bachche ko hoti hai, how kindly counsel us. This is the one thing. Second is, as we are following the child, how we can preventive counseling, we can say, how we can give to them.
Okay. It's a long topic. It will take 2 hours to answer, but in simple way, I'll answer. My own 2 small sons, my sons, now they are big, of course, they are 30 plus. When they were small, they were brought up by my mother-in-law, who was a chemistry professor. So what used to happen is, when I come, they will wait near the gate. As soon as I come in, they will say, oh, something happened. Now don't shout. Ammuma should not know. Grandma should not know.
That means they wanted to be good boys in the eyes of the grandma, not necessarily father, because they know father is indulging. So there has to be one person in the house for whom the child has such a, in a real relation with that. Normally, it cannot be the father or mother, because mother get angry because she is stressed from all sides. Because of the stress, he is likely to get angry, sometimes shout, use bad word, in spite of the best affection she has for the child. The father, as all of us men know that, we all know theoretically talk about it, but we cannot take the trouble of sitting with the child and helping the child. So ultimately, it is usually the grandfather or grandmother. Now, disciplining father is important, but to make that discipline not strong, modulate it, the grandfather is there. Whatever you do, I'll give an example in Japan, where if the child is making noise in the, too much nakras in the tantrums in the mall, the parents will just stand there. Nobody passes by will look at a child. And the parents also will sit like this, talking something else. In between, they'll ask, is it over? Understand my point? So that is enough. Nobody make the situation worse. That is enough. So that is early age. That's how you get good habits. Then the problem with parents is, we know that the child also know our secrets. We are not all that perfect. We don't behave. We use bad words. I will just say a local word, pandaram. I use it sometimes. Now my 5-year-old started using. Somebody came and she said, it's not a bad word, but it's not a word that a child should use. So they take it for granted that if the parent is behaving like this, you can behave. I'll give another example. When my children were small, when I was driving, and if somebody jump or do something, I used to abuse. My wife many times warned me, don't do that. But one day, even before somebody is going to jump, my son abused him. In the car only, he has not heard it. And wife looked at me and I said, never again in my life I have used bad words. Because the child learns that if somebody is going to cross or jump or something, you are supposed to do that. So society, we learn all this habit. The teacher is the only person who can teach good habits to the child. I'll tell you, this COVID days, my small 5-year-old is coming and telling, Grandpa, you cannot do like this. You should do like this, your shoulder, because my shoulder has little problem. Then I said, no, this is not the way to do. Put your hand like this, do like this. I said, how did you learn it? My teacher told me. So teachers are the persons, and teachers say, eat vegetable. Okay, they will eat vegetable. Teachers say you don't see too much of thing in the young age, not adolescence. You get the point? So similarly, your problem, I understand, a cultural thing. You're asking patients from Canada and all from Indian background come, they expect them to behave like Indian kids. Don't forget about it. It's not going to happen. My own family, my brother-in-law used to say, his brother's daughter, he take all the trouble to go to their house in the US, spending his own money, flying there. When you go there, they'll say hi, and they go to their room. Never ask, do you want a cup of tea also? Can you expect that behavior here? No. I was in Australia, 88. I was asked to stay back, register for a PhD, stay back, but I didn't want to be there because I have seen Indian children suffering there. Parents want Indian culture, their friends want American culture. Using F word is a standard in the school, but if we use F word in our thing, we don't appreciate. So that is a problem. It's not easy. It is not at all easy because cultural, what is appropriate there is entirely different, and you can't make that child. But there are some families, I tell you, where whatever you do outside, parents don't say don't do like that. You do everything like your friends. But within the house, you should not be like that. Get the point? And the man I always admired for that was our late Raj Kapoor. What happens outside, that is not our botheration. His films all different. But he had a decorum in his house. No fly can move without his perfect. Old Raj Kapoor family. That's what I was thinking. Why I put that name is, because his films are entirely different. But family life is entirely different. So such standards you have to put. None of his children actually went astray because of that standard. Many families, do like that. Okay, sir?
Thank you. Thank you very much, sir. So I am very thankful to my Jaipur team for doing so much work for AHA activity. I had noted down, and they conducted the third Osamaya in this Jaipur, Dr. Kala. I'm very thankful to and pay my deep gratitude to all the team member of the Jaipur. Thank you very much.
So I have one suggestion for you, sir. One suggestion for you, sir.
Anji.
So much of webinar is happening across the country by every chapter. So much information is being collected. I think AHA should consolidate all this and come out with some publication of all this. Because
sir, what we are planning now in the next coming year, we are going to have some research work.
No, research is separate, sir. What I'm saying is, so many webinars on so many different topics have been done by all AHA branches. As the president, you ask them, request them to bring it together, and this can be next 3 months. It can be consolidated and put it in a book. I can do the editing for you. If the material
thank you very much, sir.
I can do the editing for you because your time, president. I think next year you may not be the president. Are you?
Next time Dr. J.C. Garg is there.
So whatever it is, your time, if another 20 years, it will be remembered if we can put all this, because so much of webinar by every branch of AHA has done.
Yes.
Put it together, send to me, I will edit it for you. That I can do. Publish it as AHA publication. Thank you, sir.
Very good.
Thank you very much, sir. We will do that. I will ask that people. We will collect everything from them.
I think it has been a wonderful session, Professor Nair. And I think with this kind of a counseling, which you have been told.
Don't say Professor, just say Nair.
Well, I'll still like to keep that entitlement, because you have really counseled all our pediatricians into how to counsel people. And I think that's very important for us to take the message. And I'm quite sure we are wiser to it in the end of the day. And it is a difficult task. And it is very important in this modern age to find out that those people whose children have been outside the country, when they come back with different values, and handling them has been a very major stressful factor for many of the younger generation parents, because they are, a split between two generations of upbringing.
Sandwich between two generations.
Yeah, and I think it has been extremely important for them to how to tackle the situation. That's great listening to you, sir. Thank you.
I request Dr. Manish Sharma, Dr. Sanjeev Gupta to give a vote of thanks from their side also.
Good evening, Professor Nair. Good evening to all my teachers, Professor Sitaraman, Dr. Chawla sir, and all the dignitaries, Professor Ashok Gupta sir. Dr. Nair sir, let me be very honest to you. I am a man with a critical care background. I am the Joint Secretary of Critical Care Chapter. Initially, when I was joining, though we have listened your orations multiple times, but being critical care background, we have a slight misbelief that we are the savior of this world. But listening to your this one and a half hour talk, it has opened up a new vision, new horizon to me about the pediatrics and what mistakes I have done with my patients, and actually what mistakes I have done with my own kids. So sir, it is actually IAP requires at least 10 prototypes of Professor MKC Nair to make people understand that empathy and your behavior towards your child is everything which which makes a huge difference. And yes, we are seeing a distorted generation these days. Sir, hats off to you. It has been a fantabulous, a magnificent talk, which I have listened in years of my pediatrics life. It has been, I just had one question I wanted to ask you, sir. Just a small question. Of all your patients, the affirmative parents, the authoritarian parents, what kind of parents do you see have the most difficult children once they develop?
Authoritarian. That means somebody who push all your ideas on the child. Most people think you have to be authoritative. Some place you have to show you are the parent. You are not a friend. You have to be friendly with the child, but not friend of the child. Both are different. Friend means somebody who agree with you all nonsense. I don't do that. But even when I have to disagree, say it in a nice way. Be friendly, but not like a friend.
Dr. Nair, just a comment on that.
Yeah.
Do you feel your individual professions has got any, changing a thought process of beginning with authoritarian parenting? Whether you are in a police or a doctor or a teacher or a, does that make the parent thinks?
I understand your question. Most often we choose profession that fit in with your personality. Okay, and you have seen so many vice chancellors. Probably I was given the first time 314 college unions got together and decided to give me a most student friendly award by the Honorable Governor of Kerala. Not even one college backed out. All of them came together and said, sir, this is a tribute that we can give to you because, but mind you, I had 5 philosophy. I think you must know this. Number 1, go by rule book. I will never bend. God himself come and say, I won't bend because God will not ask me to do wrong things. Secondly, examination sanctity. Never, never touch it. Okay, but 100% student friendly. And respect the right to be heard. Children only want them to be heard. And 5, give respect and take respect. Even the cleaning person come to my office, you have to sit down before you talk because I don't talk to a standing person. So children come with crying that I lost by 1 mark and all that. All sort of things has happened. But what I make them understand is, better, this is a rule. Let me see what can be done within that. Then I will send him to the controller. He'll say, this is the rule. He can't do anything. Then he say, go to anybody. Tell me some way I can manipulate. I want to help you, but I cannot break the rule. What can I do? After 2 days, they'll say, we consult advocates also. They said, actually, you can't be do, but you can go. If you want, I can give a written the court, but you won't win because that's it. So the point is, we want, this is what every wife also want. They just want to have the feeling that they are being heard, not done. They just want they are being heard well and your response is positive and not negative. Sir, I think every profession, policeman become like that. Policemen become like that because of extreme pressure. But even there, you have police who behave very nicely, extremely, especially in the higher level, because they don't have so much of stress. But you can't blame a casualty doctor getting angry sometimes. I can understand. 200, 300 cases come, all different character. He may be angry, he may be little. But there also I say, I'll stop by saying one thing. One day, 8 o'clock, after 12 hours of duty, I was about to go. The next person hasn't come. So I waited. And there comes a van, one bus full of school children with all vomiting, diarrhea, whatnot. They ate something or they drank something. What do I do? The other fellow is late also. I can't leave the children and go home. I was burning inside what to do. But then I asked myself, will it work? It won't work. So I thought I put them all segregated, triage, those who are vomiting, IV, few of them, very few needed IV and all. And then we started, playing with each other. Children who started playing with each other, I joined them with this. By the time the new person came, it was 1 hour. Almost 99% of children could be sent home. That stressful situation, I could make an enjoyment because I realized that no point in, if you get angry, you are going to say wrong things. Somebody, parents are going to react badly. They wondered, is there a doctor like this? Not because I was good, but because I was more intelligent to handle the situation. It's not goodness in me, but given a situation, this is the way you have to manage. If you manage, then it will work.
Yes.
Well, that's amazing, sir. That's amazing. I mean, you have not even given a way of adolescent counseling, but a way of life. And actually, that's very true. That everybody faces such kind of situations, and the only thing is that you have to face it. Either you face it by taking it in your stride, or you keep on criticizing other people. So Jaipur, the IAP Jaipur branch is extremely thankful to you for giving a wonderful oration. It has been a wonderful, lovely 2 hours of learning human behavior, human interaction, human aura, and human sphere. That was great. We thank you from the bottom of our heart, and we wish to see you soon. Thank you so much. Over to Sanjeev.
I think Dr. Sanjeev is not here. So over to Dr. Mohit Vora. Dr. Mohit, are you here?
Yeah, I'm there. Am I audible? Am I audible?
Yes, you are.
Good evening, everyone. I think what a wonderful 1.5 to 2 hours. Everybody of us was absorbed in the golden words and enlightenment given us by Dr. M.K.C. Nair, sir. It was really wonderful. I think it is much easier to pen down antibiotics, painkillers, decongestants, antispasmodics in a couple of minutes. What is most difficult part is the counseling. And what is the most difficult part of a life to counsel is the adolescent age. Why the adolescent age? Because the person is completely independent here. He has different flight of ideas. So yet another deliberation by Dr. M.K.C. Nair, sir. Beautifully, he has explained us how to manage such difficult situation. Thank you so much, sir. And as a treasurer, AHA Jaipur, I would like to take this opportunity to thank all of you, all the Dians like Chawla sir, and all the stalwarts pediatrician of IAP Jaipur, Dr. Ashok Gupta sir, Tarun Patni sir, and everybody else who was there. Sita Raman sir. I'm sorry if I'm skipping any name. A backbone of AHA Jaipur, Dr. Swati Ghate, Dr. Kusum Kalla ma'am, Dr. Sethi Dynamic Secretary MSA, Dr. Sanjeev Gupta, and the audience without whom, and the sponsors without whom this would not have been possible. So thank you, all of you, for such a lovely evening. Thanks.
Thank you. Thank you all. All the seniors.
Thank you so much, sir.
Thank you, sir.
Thank you, sir. It was a great learning. Thank you so much.
Great learning, sir.
Thank you.
Sir, Dr. Tarun Patni has joined now.
Yeah. Just say hello. Sir. Namaskar. Namaskar. Can you hear me? We have shared so many moments. Can you hear me? Parnik sir. Thank you.
Auntie, sir, unmute.
Sir, I can hear you, and since my PG days, the first thing, handling a spastic child, I still follow all your protocols. Newborn.
Thank you, sir.
And especially when you had told that traditional holding of the child with both legs on the lap of the mother is one of the best ways. So I'm really shocked that small things which you observe and inculcated in us are really great.
Really. Sir's words keep on sounding in our ears. When I see my patients, I hear them again and again.
And And he remembers everything. And with Jaipur, his attachment with Dr. Sukumaran and Dr. Kamath is really great. And sir, someday we will like to hear you live right again in Jaipur. So
Okay.
hope next year things will be better off.
As I'm getting younger and younger, is it possible?
Yes, sir. You are so young, and your thought process is, I think, much more younger.
Yeah, correct.
And that is the most important thing to be a good teacher. You have to learn, and especially with parenting, because now you have to teach parenting and maybe to modify the parenting skills with whom you have already counseled in their childhood.
Yeah.
That must be quite tough, sir. What do you say?
Yeah, I have parents like that. I have parents.
Yeah,
Now,
yeah.
whom I have seen as small babies.
Yes, sir. So you may have counseled them,
Yeah, yeah.
and now you are counseling them as parents. So it must be quite tough. Two different versions with changing time. So, sir, thanks a lot, sir. And really, I am really thankful to all, and especially you have given so much time. Thank you. Thanks a lot.
Just ask her name. She loves. Somebody ask her.
What is
What's
your
your
name?
Tell.
My name is Shishami Sabri MKC Doctor.
And who is your
Lovely.
best friend? Huh? Your grandfather is your best friend?
Ameya.
Yeah. School.
Cool friend.
Okay, sir. Good night.
Thank you, sir.
Okay,
you.
good night
sir.
to everyone.
Thank you so
Goodbye.
much, sir.
Thank
you.
Chawla
Okay.
sir, thank you so much.
Thank you, Chamla sir.
Grandparenting is the most
Thank you, sir. Good night, sir.
And
relaxing.
thank you, Dr. Kusum and Dr. Priyanshu,
Thank you, sir.
for
Thank you,
moderating the
boss.
session.
Yes.
Thank you.
And
It was our pleasure. It
platform.
was our pleasure.
Chalo, good night.
Good night.